Good morning, everyone. Thanks to those who are wandering in and grabbing your chairs and seats. I am Kariana Wilson, one of the co-hosts of the State of Reform Healthcare Policy Conference. So thank you for being here for our third conference in Spokane. I probably guess that some of you are used to seeing DJ up here and his name attached to State of Reform. And this year, we had a little kerfuffle in Oregon that the Oregon legislature did not talk to us about when to schedule their committee days. And we had our Oregon Portland event scheduled on a different date, but they scheduled their committee days on the conference. And we can't really host a health policy conference without legislators and health policy staff. So we have today two events happening, one here in Spokane and one in Portland. So thank you to our team today who are in two different places and hosting two different events. And thank you all for being here today. We are, as I mentioned, have our event in Portland this morning. We have a couple other conferences, as probably some of you are aware, in Oregon, in Alaska, and this year we are expanding into California. We have our first event in LA in November, and we have then another event coming in Sacramento in the spring, in April. I can't see my slide. Okay, good. So for those of you who are familiar with State of Reform, you're probably familiar with our website, hopefully. And currently we have approximately 100,000 unique visitors to our site. And those visitors are from actually all over the country. While New York understands, and the New York Times can write about healthcare, they don't know local, they don't know Spokane, they don't know Olympia. And that's where we try to fill in that gap by bridging healthcare and healthcare policy. And we have the 5 Things newsletter, which hopefully most of you are seeing. DJ puts a lot of himself into bringing that content and that unique analysis. And today our managing editor is here, JJ, who also does a lot of that content and pulling that newsletter and email out to everybody. So we hope that today is a part of that expansion of State of Reform, and that everybody has an opportunity to have dialogue with people they're not used to maybe seeing, opportunities for fostering reform and moving the ball forward a little bit. That's kind of what our goal is. We think of State of Reform and as there's sort of 4 different cohorts that help us put this event on, and one of those is our convening panel. The other is our sponsors, who we could not function, we couldn't put this on if we didn't have our sponsors and supporters. The other is all of our speakers. Today we have over 65 speakers, and that's a big lift to manage and to bring people here to share their expertise and knowledge. And then we have all of our attendees and registrants. We couldn't host a party if people didn't come. So we appreciate you all taking time out of the day to be here to talk with one another and share your experience. So thank you for that. We rely on our convening panel. We have about between 20 and 25 folks who we count on to provide us feedback about our agenda, about what works for each market, because Oregon's very different than Alaska, for instance. Eastern Washington is a little bit different than what we talk about in CTAC. So thanks to our convening panel members who help guide us and sort of steer us on what the agenda should look like. And just a special note to, we have a note in our program to Tom Fritz, but he was one of, and INHS was one of the first supporters of bringing State of Reform over to Spokane. And he was a stalwart attendee and participant and sponsor, and we truly appreciate that, and just wanted to take a minute to recognize his contribution to State of Reform here. Wanted to talk also about our sponsors, our event sponsors. Primera has been with State of Reform as a sponsor in Washington and SeaTac and here in Spokane since 2010. And we we couldn't put this, I guess we can't say that enough, in appreciation of all of the sponsors who support this endeavor and or have the intent of having an open dialogue and with no agenda from them. They're just coming to support, and we rely on Primera for the last 5 years. Empire Health Foundation, thank you, Anthony and team, and thank you, Kristen. She will be moderating our luncheon keynote today, so thank you for that. We couldn't do this without Empire. It's a small community, and they have helped us bring together and provided us feedback on speakers and what works here, which is different than what works in CTAC. And Providence. Our conversation with them, we continue to hear that they are committed to reform in all of the markets. They are with us in every market, including California. And as we move into different states, we need to have that stakeholdering to make this possible. And they have done that with us. And I want to also mention Molina, fantastic. United has been really engaged in our agenda, and new sponsor, Hall Render, which is new to the Washington community. PH Tech and Engage, which is INHS, and Eastern and Wazoo. Thank you to all of our volunteers. A lot of those folks are students. So if you have questions, they're seated out front and can help you. I just wanted to go over briefly your program. The details of the panels are in here, but on who is speaking on each panel. But the page you might want to kind of keep your eye on is page 7. That has the picture of what the day will look like for each breakout session, and the descriptions are behind that. And before I forget, we always get a ton of questions on where are the bathrooms. Women's to the left when you go out the door, and men's are to the right. So you all are prepared and know. I just wanted that right after I go, we will have Lisa, Chancellor Brown, come up and speak for about 20 minutes, and then a Q&A afterwards. And I think after that, we'll close the program in here, and we'll move out into the breakout sessions, which are upstairs. So all 4 of the breakout sessions are right up the stairs. So with that, we'd like to welcome Chancellor Brown and give her an opportunity to talk about what's happening here in Spokane with medical education and policy. And afterwards, Representative Riccelli will join her seated up here for some Q&A. Here's the clicker.
Thank you. Good morning, everyone. Lisa Brown. I'm going to, I think, move out a little bit, and we have this is my first Prezi, so wish me luck with that. I have had the amazing opportunity to have 2 dream jobs in my life. I was able to serve the people of the 3rd District here in Spokane for nearly 20 years. And now I am the Chancellor of WSU Spokane, which is the health sciences campus for the university. And in both of those capacities, this conference and this group of people have been very significant. What my goal is today is just to hit on some of the key trends that are happening that are leading to health in the state of Washington. And let me just say that those trends are, in some cases, global and national in nature. But in all cases, they are happening in the state of Washington, all over the state of Washington, with all of the partners in this room and many others. And they're all happening in Eastern Washington as well. Our city slogan is near nature, near perfect. And I hope after today you also will agree it's near nature, near education and healthcare, and near perfect. Let's get going. The first trend leading to health is educating more primary care providers. And that is across the spectrum and all the pathways that need to be developed to engage people in communities and then into healthcare professions. And here in Spokane, we are very excited about building those pathways from community health worker to PhD in nursing. And you may be also familiar with the latest endeavor that we have been embarking on, and that is building the physician pipeline in Washington State as well. And I'm sure this group is very familiar with the problem and the need with the doctor shortage that we have, aging baby boomers and aging physicians, and the reform movement contributing to this need because of bringing more people into healthcare access. Washington State, though it has an excellent medical school in the University of Washington, has a small number of medical school seats for Washington students. We, as you know, went to the legislature and worked to receive permission to establish a second publicly funded medical school in Washington State. This is part of the physician pipeline. Also, residencies are another key part of that. And very excited to say that one of the happiest days for me this year was the day when the governor signed the bill permitting the establishment of the second medical school. And you see our president, Elson Floyd, there. It was also a very happy day for him. And we're very sad to have lost him, but I'm happy to have been part of this journey with him to launch this medical school. We will be now with PNWU and the University of Washington educating more primary care physicians in Washington State. Our medical school plan is to be community-based, to recruit students from all over the state of Washington, and particularly from underserved areas and from small towns and rural communities, to train them in those communities with their first and second year of medical education here in Spokane, but their third and fourth year with clinical partners all over the state. And then we also hope to grow more residencies in the state as well. Because we're a university, I have to talk about research as well. And we have the full spectrum of bench-to-bedside research. And that is part of the trend that I think is leading us to better health outcomes in the state. This gives you an example of just a few of our researchers who've been in the news lately. It's very exciting to work on a university campus, and particularly a health science campus, where the faculty that I engage with are doing fun things like looking at our sleep patterns, looking at how babies experience pain. And here to give you just a taste of that is Martin Schiavinetto. Oh, let me go backwards. They'll tee it up here. Martin Schiavinetto from our College of Nursing, who will talk a little bit about his research.
What we're doing right now in my lab is we're developing devices to measure pain, specifically in premature infants, by capturing various behaviors and various physiologic signs that are part of the pain expression in this population. So for example, one of the things that they do is they open their hand like this. They call it the salute sign because they bring their hand to their face, or their stop sign. So we develop a sensor that captures that behavior. Grimacing, or the crying is very important and plays a key role, of course, in the pain expression. So we have a sensor, we're developing a sensor right now that captures the specific movement that is associated with the pain expression, as well as their heart, not just their heart rate, but certain frequencies in their beat-to-beat rhythms that are key and indicate pain.
So that gives you an idea of the excitement of the research enterprise that's taking place in Spokane. The other really important and exciting event is the partnership that we've created in order to expand medical residency positions in Spokane and Eastern Washington. We're building a clinic on campus. The Spokane Teaching Health Clinic will open next summer. And this is part of an innovative partnership with Providence Healthcare and Empire Health Foundation. Providence has been a longtime sponsor of medical residencies. With the Affordable Care Act, a new stream of community-based residency funding through HRSA came about, and Empire Health, WSU, and Providence joined together and applied for slots in family medicine and internal medicine. I'm happy to say we're also embarking on the rejuvenation of the psychiatry residency as well. So that important pipeline is key, because I think many of you know physicians are more likely to practice where they do their residencies, and there are very few residency slots east of the mountains. So this kind of partnership needs to duplicate in order to attract and retain more physicians in our rural communities. In our community clinic, our regional Better Health Together ACH will be in the clinic with an office. We'll also have a medical legal partnership in our clinic. And our goal is to make this not only an interprofessional teaching clinic where students and faculty from various professions can learn to practice in a team-based environment, but one in which when community members walk through the door, we can look holistically at the challenges they face with respect to healthcare. And and by having these community partners in the clinic, we hope to be able to make the clinic really a neighborhood resource. Congratulations to the state of Washington's policymakers. It's been a long, at least 20-year journey, I know, for some of you working on the policy issues, but Washington State really is leading the way, as you'll hear later today, with the Medicaid waiver that we're pursuing in more innovative ways to surround people with the services they need that really lead to health. And the integration of primary care and behavioral health is a very important development, and I know we're going to hear more about it today. One of the things that's exciting about being able to start a medical school is you get to design a curriculum from scratch. And Ken Roberts, who's here with us today and will be speaking later, and I have had a great opportunity calling medical school deans all over the country and saying, well, what would you do if you were starting a medical school? And one of the things we heard is that we have an opportunity to put P4 medicine in the classroom. You're probably familiar with Dr. Leroy Hood and the model of predictive, preventive, personalized, and participatory medicine. And one of the exciting aspects of those technological developments is that now we want to train healthcare professionals to be able to utilize them. And here you'll get a flavor of what that will look like.
Using an individual's genetic profile to guide prevention, diagnosis, and treatment of disease is now a reality. And that's what we call personalized or genomic medicine. So it's a very exciting time for medicine. What is making personalized medicine more accessible is a recent revolution on genomic sequencing technologies. So right now at WSU, we have recently established a genomic score, which is the only high throughput sequencing facility in Eastern Washington. So to give you an idea of how accessible sequencing has become, nowadays in our facility we can sequence most of an individual's genes, which we call the exome, for about $600. So students can benefit from the access to that resource, so interacting with researchers that are doing genomics in their practice, learning how to gather and interpret genetic information, and maybe even as part of their class, sequence a classmate's exome, which is an incredible opportunity. Now, we are designing our medical genetics curriculum to not only cover the classical inherited genetic diseases, but to teach students how to gather this information, what the technology is, but also how to use the genetic information to guide the care of patients. Now, it's important to remember that genetics is not destiny, but that kind of information can make a huge impact on decisions about healthcare. So WSU medical students will have the opportunity to train on how to use genetic information to guide patient care and truly be able to provide personalized medicine.
So I stole this line from some of you may know, Rich Umdenstock, who had been engaged in healthcare here in Spokane and then went off to the American Hospital Association. And I had the opportunity to hear him speak at the Rotary Club in downtown Spokane last week. And he inspired me, as have the leaders of our healthcare systems here in Spokane, by talking about the innovations that are happening in hospitals and health systems, moving more towards prevention, the new transparency of looking at metrics and outcomes. We know it's also a very unstable time with payment systems changing, but what I see across the board here with the leaders I interact with is their excitement to throw themselves into this and work towards better patient outcomes with their systems. Allowing healthcare professionals to practice at the top of their license is both a smart thing to do and one that will improve outcomes and lower the cost of healthcare. Our president and vice president of our student body this year are both pharmacy students. Very happy, as you can see, Carl there. And Linda Gerolds-McLean from our pharmacy program will explain a little bit about what this piece of legislation will mean for Washington.
Strep throat might be something that an individual thinks is in place. So coming down from skiing on a Saturday night, you might not be able to get into your physician's office, and other alternatives, the minor emergency care center or the emergency room, might not be a practical choice. So you could come to your pharmacist in a pharmacy that offers this kind of service. The pharmacist could perform a test, and if the test is positive for strep throat, could, when appropriate, write a prescription for the antibiotic that's needed for that individual. So this does a couple of things. This increases access to care for prescriptions that might be needed for common conditions. And when you're able to get access to that care in a timely manner, we're able to get you on the road to recovery more quickly. Another example of a minor ailment or condition that might be one that can be assessed in the community pharmacy for pharmacists of the future and now would be cat scratch or a minor burn. So this is just an example of the way that we're training our pharmacists to really, truly be members of the healthcare team of the future.
So you'll also hear more today about engaging employees in their healthcare and obviously engaging the community to improve healthcare. This was the Cougs versus Husky blood drive that happened across the state this year. So UW and WSU students engaging in a little bit of competition off the football field in order to also get people to do the right thing and give blood. And these kinds of involvements of students in the community help also give them a more realistic focus to the kinds of lives people lead that don't always have access to healthcare. Team-based care is also part of the wave of the future. This is a picture of our sim lab, and these are the health science programs happening on our campus right now. MEDEX Physician Assistant, the WAMI program, Eastern's Physical and Occupational Therapy, Dental Hygiene and Dentistry, and as you can see, Nursing, Farming, and soon-to-be Medicine. Here, Cindy Fitzgerald will talk about what's happening in team-based care.
So we're fortunate in having a variety of students. We're also really fortunate to have high quality simulation and standardized patient services on this campus, because what we can do then is we can pair students with one another, put them in small groups, and give them standardized patients to interact with that sort of mimics what they're going to do in the actual clinical situation. So we can put a team of, let's say, 5 students, nursing, pharmacy, medicine, occupational health or physical therapy from Eastern, nutrition, exercise physiology, we can put a group of students together with an actor who's pretending to be a patient and give students real-time, real-world experience in interacting with the patient. In that situation, the patient can also give that team feedback. I liked it when the medical student said this. I didn't like it when the nutrition person asked me that. And the students also learn from that interaction. So this isn't theoretical learning, this is real world learning, where we're using actors, we're training actors to pretend that they're patients, to give students real world opportunities and feedback from real world patients. So I think that what we're doing in WSU Spokane is unique because of the partnerships that our students can form with other health professions. There's a tremendous amount of synergy on this campus among the various healthcare professional students that we have, and the real world opportunities to practice with standardized patients are unparalleled.
The other important trend that we are embarking on, but only still have a long way to go, is creating pathways for rural and underserved students to become primary care providers. Our Nahashni camp in the summer brings Native American students for a 2-week experience on a health science campus. It's now in its 20th year. It started out as a nursing program and has now expanded to the other health science programs. But as we've gone around the state and spoken to high school STEM classes around the state, we hear that they want more experiences like this. We've also just hired at WSU Spokane a new public and community health group that have partnerships for Native Health has been part of their portfolio. And the new entity that we're developing is called the Initiative for Research and Education to Advance Community Health. And we want to explore more ways to translate the research outcomes that are coming out of the campus into diverse settings, diverse cultural and geographic settings. Finally, we all know it's about our behavior in the end. And the exciting thing is to see students going out to elementary schools with monitoring, giving them the ability to monitor their steps and measure their fitness. And in the end, these kinds of trends will definitely impact health. We know it's about what we put in our bodies, how much we move and our fitness level, the kind of food we eat, and one of the key areas that we explore on this campus, how much sleep we get. So I just want to encourage everyone, if you have a free hour during your visit in Spokane, go off on the river to the east. You can take a loop walk past our campus and cross the bridge near the Gonzaga Law School and come back the other direction. Or if you have a little more time, go to the north bank of the river and go west to Kendall Yards and take that loop. And in the end, this new focus on our eating and moving and behaving is also going to make us feel better. And I can tell you that having become familiar with the sleep research on the campus, I really believe that sleep deprivation contributed to some of the most negative outcomes I had during my legislative years. So with that, I'll welcome to the stage Representative Marcus Riccelli, who can tell us a thing or two about long legislative sessions.
Excellent. Thanks, Lisa. And thanks to everybody. I want to also give a proper welcome from the 3rd District. Appreciate those of you who've traveled here. Spend money. It's good economic development as well. I was worried for a second there on the sleep research point that Lisa was going to say, go to the river and take a nap. Don't do that. Spend some money or do something fun and take a nap when you're back from wherever you came from if you're not from around here. That was a great presentation. Really appreciate it. There's a lot of exciting things going on here in Spokane and Eastern Washington. Appreciated the the shout out to Washington leading the way, and I do want to recognize, I saw one of the ways we're able to lead the way in healthcare is that we have good partnerships in the legislative process, and I saw Representative Schmick, who's the ranking member on healthcare, and Representative Harris, who's the assistant ranking here from Vancouver. I serve as the vice chair of the healthcare committee. So let's get right into it. Let's go right into some of the initial controversy. Who's the best staffer that you have ever had that went on to get elected from the 3rd District?
That would definitely be Marcus Michelli.
Okay, we started with the hard stuff. So what do the next steps look like after that presentation? I saw EWU up there, WSU, UW. I saw all kinds of partnerships. What does this mean for those institutions? And then what does that mean? What is this whole process? What did it really show you about WSU as well?
Well, there was a little controversy over the creation of the medical school, but I think what's really exciting is that we need all of our higher education institutions in the state, and that is public and private, engaged in creating the healthcare professionals of the future and more healthy outcomes for communities. So right here in Spokane, we have our nursing program and a nursing program at Gonzaga right across the river. So I really believe that having the presence of the new medical education program is going to be a positive for the state, and that partnerships for our students are going to be more important. Or let's just say it's not all about the rivalries on the playing fields. It's also about the partnerships the students and faculty can establish in their research labs and in the classrooms.
That's great. I started with some questions that I wrote down before I came here, and then after your presentation, it looks like my 5-year-old scribbled all over. So I'm going to just kind of go with it here. And so I saw a piece on engaging the community. The 3rd District here in Spokane is one of our, as you well know, representing is one of our poorest districts. Do you really think that just by having the focus on health sciences that we can change outcomes, engaging students in our community? I was really excited to see some of the initial partnerships and working in various neighborhoods that are poverty-stricken. What do you think that means for our community here?
We're thinking right now a lot about that question because I know that although we're building a clinic and we're building a bike pedestrian bridge over the railroad tracks into the East Central neighborhood, thank you legislators who voted for the transportation package, but that doesn't mean that the residents of the neighborhood are going to cross the bridge and come to the clinic. So I really think we have to think about how we're going to go out into the communities. And certainly if we're not even sure how we're going to go across the tracks into the East Central neighborhood, then that makes the ways in which we move out into rural communities and small towns even more important as well. So rural tracks for residencies, the development of technological ways in order to engage people where they really are. I think that was what was exciting also about the pharmacy bill that passed, is that if people aren't coming into a traditional healthcare institution, how can we take healthcare into the places where they are, whether it's an elementary school or it's a local drugstore.
Great. One of the bright horizons I think a lot of folks see with WSU Medical School and just with everything going on with healthcare is the potential for economic development around research. It was exciting to see some of the research, especially around premature kids, as a father of 2 kids that came at 35 weeks, all kinds of exciting stuff. I visited the Sleep Research Center. But do you really think we can do research right here?
Well, currently Eastern Washington has a small cluster of biotech and biomed companies. A cluster is important because you need the ecosystem of support, so people who can work for one venture might be able to hop to another. And so there's a group of partners working here, the local business community, Greater Spokane Incorporated, Empire Health Foundation has been engaged. We have an entity here known as the Health Sciences and Services Authority, HSSA. This was created during the time I was in the legislature, and it's a unique entity in which 1/10 of a cent of our sales tax in this county is retained by the Health Sciences and Services Authority, and they can redeploy that to support health sciences research and access to health care. This is an economic development tool that currently is only available in Spokane County, but theoretically could be available in other counties. And also part of that ecosystem for economic development is being able to really attract high quality researchers and then equip them with the equipment they need. The approach that we're taking at WSU Spokane is to have our research infrastructure in core facilities that are available across the campus to reach researchers from nursing, pharmacy, and medicine, but across the community to researchers in Providence or in private sector companies as well.
And I kind of want to follow the research angle and ask you, the Life Sciences Discovery Fund is being phased out. There's a new cancer research initiative. What do you think that means for Eastern Washington particularly? Does it mean anything for Eastern Washington?
Well, the Life Science Discovery Fund, I think, was an important tool that helped a lot of researchers leverage additional funds that they could get from federal research sources. And so I'm sorry to see it go away, but I'm excited about this new cancer care research fund. I know that it's still in the early development. I think as long as we ensure that there's the ability for entities all over the state to utilize it, and we think about how to govern it so that we can really utilize what I know will be a limited amount of state resources to leverage other private sector and maybe national resources, that it could be a really important tool for Washington State. There are other states that do a lot more to pull research dollars in from the state level around healthcare and biomedical research, and I hope that Washington State figures out a way to kind of stay in that game.
Excellent. Switching gears a little bit, legislators love to talk about jobs being created. What do you see up next in this area around workforce development in the healthcare sector? I think we've banked, obviously, a lot of our future around the healthcare sector here in this region. I think it's a good bet, but what do you see as kind of what's up next?
Well, I know there's a big, let's say, it's unresolved where we're headed with education funding in the state of Washington, but I see education funding, as I know you do, across the whole spectrum, early learning all the way through higher education. And once we're able to figure that out, hopefully more healthcare workforce development pathways are part of the focus that the legislature takes. And I know that there have already been some moves in this direction. One of the issues that students face is the loans they have to take on to go into higher education, and especially if they're going into a healthcare professional program after 4 years of college. They often come out of that with a high amount of debt. That can limit their ability to practice primary care, to practice in a smaller town or rural environment, because they may need to go frankly for the higher paying job that can help them pay off their loans. So I really hope that as the legislature takes on this education question, they take it on comprehensively across the spectrum and look at healthcare workforce development, not just the physician workforce, but really all the primary care professions, and figure out ways to keep that access for students and families.
Yeah, it's interesting. I saw a lot of excitement around student loan repayment issues and how we can make that work. Obviously, funding's a big piece of that, but on both sides of the aisle, in both chambers, there was a lot of excitement and enthusiasm around incentivizing folks to go in some areas where they're underserved or rural. So we're really looking at that and trying to make that a priority. You talked about the team-based integrated care model, and technology is such a huge piece of what's going on right now. I mean, are we going to be potentially walking into our pharmacies and then having little offices right next where we're going to be talking with doctors via using telehealth technologies. I mean, these things are all coming of age right now and on the forefront, and I think in other states they're moving forward. How do you integrate technology into all this curriculum and make sure that our students coming out, are getting this important piece of education as it's being developed, as they're moving through the system in the pipeline?
I think the new technologies are going to give us a lot more information, and that means there'll be more healthcare information on your phone and on the wearables. I see that there's a session about that topic later this morning. And one of the challenges is, well, what do we do with all that information? How do we utilize it wisely? So I think one of the other key issues is bioinformatics and figuring out how to really train healthcare professionals to be able to utilize the information that is going to be provided. And let me point out that it's both exciting, but it has, like all technological developments, both it raises concerns at the same time that it raises hope, because these devices also track a lot of our personal information. And so we need to also stay on top of privacy issues and how to safeguard personal information for patients and people, at the same time providing them the tools they need to improve their health and maybe prevent negative health occurrences.
So go back a few years, you're majority leader again. Let's talk about if you were majority leader now, throw a little curveball out there. What should be on tap in a short session for healthcare? And be brutally honest, what is the legislature missing right now? There's only 3 of us here, I think, right now, and it's maybe going to be on TVW. So but don't mince words. We actually, what's your thoughts? What do you think we should be focused on in a short session? And then also, what do you think that we're missing right now that we should be maybe redirecting more of our attention to?
I know that this has been slow in coming, but I believe we're going to hear that we're still grappling with it. But coming from an economics background, I really do believe people respond to incentives and disincentives. And so it's pay structures that also drive change in our healthcare system. And so I think we have to keep on that track. I think we have to keep looking at the ways in which we incentivize or do not incentivize good outcomes. And that's everything from the kinds of decisions a patient makes, but the kinds of decisions a healthcare provider makes. And I know that having done my own tilting at this windmill, that the tax and revenue structure of Washington State makes it very difficult to make some of the investments that we need to make. But if we were able to make those investments in early learning, in the kind of integration of health and social services into neighborhood settings, it would have such a dramatic payoff for us in healthier, happier people. So I was just thinking, speaking of the curveball that you threw to me, I thought you were going to say the best staffer I ever worked with, not the best staffer who then ran for office, because then I would have been able to talk about Jonathan Seib, who's here today and going to be speaking
well played,
on
I think.
one of the panels.
So I think we have around 5 or 6 minutes left, and we were given the opportunity to maybe throw it open to some questions. I don't know if there's any mics in the audience, but do a little audience interaction since it's the morning, liven folks up. I mean, you're in my hometown, you're in my district. If you're traveling, we want to have a little energy and excitement here. So if somebody has a burning question, okay, way in the back, but you're gonna have to be loud. I don't think the mic's gonna reach you. I'll repeat it if I can hear it.
Where I think the other medical school went wrong in terms of providing doctors for our state is they kind of got trapped in this research national reputation thing. And I heard a lot of good things in your presentation about primary care and integrated care going on in the community. But how are you going to prevent your medical school from getting caught in that same trap of rewarding teachers for research and grants rather than teaching and clinical and community service?
That's an excellent question, and we're grappling with that question right now as we are in the process of hiring the founding dean for the medical school and looking at how to resource it both within Spokane and across the university. And I tend to be a little bit of an optimist, hopefully not overly naive in this area, but my hope is that we really have a hybrid that stays true to the mission of a community-based medical school, as well as continues to recognize the value of having a research infrastructure in Spokane and Eastern Washington, and that they can then feed off of each other. The real way that we're going to do this is by the clinical partnerships. We have been going all over the state and having these affiliation agreements with clinical partners, not only here in Eastern Washington, but in Everett, Vancouver, Tri-Cities, and other parts of the state are going to be key to really creating a primary care physician workforce. The students need to be recruited from those communities, and that's why we need stronger STEM programs and bridge programs that connect students to healthcare professional programs. But then they need to go back and train and practice in those communities. And clearly at the federal level, we need more funding for residencies and or reform of the residency funding system so that we can create those high-level experiences after graduation from medical school all over the state. And that, I think, will be a key part as well. Our goal is to have our students do really longitudinal experiences in communities like Tri-Cities, Vancouver, et cetera, and in those longitudinal 2-year experiences be able to go out and experience the smaller communities and rural areas surrounding those cities. And we're hopeful that in that type of educational environment, they interact with clinical partners who get to see the students, encourage them to stay in the community, and we all know that the longer you're there, the more likely you are to meet your future spouse and make the kinds of ties that will want to keep you in the community.
And I do want to reiterate, because there was a premise in the question about kind of some of the tensions and different directions, but I will say, legislators came together even though it was tense at times, and this area really did well. We expanded WWAMI as well as passed a policy bill to create a new medical school and add money for the founding for accreditation process. And I will say, I appreciated you showing that picture up there. Although I'm wearing the same suit, it is a different tie. I'm on a legislative salary, so if anybody notices that closely, maybe we have time for one more question, and then we'll wrap up. If any, in this room, in the state of reform, there's got to be another question. Okay, thank you, because for all the folks who want to meet with me on legislative stuff at some point, if I'll say, well, you didn't ask a question in the middle of that.
Test. Yeah, have you looked at MedX as a possible model for integrating some of the PACs? You talked a lot about getting primary care and utilizing these guys as mid-level providers in primary, because it is a fast track and they have done a lot of successful things within WWAMI. So I don't know if you guys are talking about that within this medical program as well.
Yes, in fact, MedX approached us about moving onto the campus, and we were able to accomplish that this year. And the next phase of the conversation is how to integrate into the clinic. And I think that is key, as well as experiences for students. We have one of these off the ground right now that I'm pretty excited about. It's called the Health Equity Circle, and I believe it started within WWAMI, and it's now spread to being present in Spokane, Seattle, and Oregon. And the Health Equity Circle concept is a class in which students from different health professions come together: pharmacy, nursing, medicine, PAs, social workers, et cetera. We're now even talking to Gonzaga about law students. And they study social determinants of health together and try to understand each other's realities and how they, and I'm pretty excited about it. I have a lot of enthusiasm for what these students will be able to accomplish if we just put them in a room together, let them study together, let them do projects together, and figure out how to serve together.
I think that's all the time we have. I want to thank you, Lisa, for your presentation. I want to thank everybody in the room, particularly because of your interest and enthusiasm in all the topics that will be moving forward today, especially as someone who came in the legislature whose greatest experience with healthcare initially was collapsing my lung on a bad dunk in high school. But working for Lisa, working for Senator Cantwell, and now under Eileen Cody as vice chair, I got to say, if I don't do well in the legislature, it won't be because of training, because I've been trained by the best. So thank you, and I think we'll turn it back over to you, Karen.
Thank you, everybody.